Today we're giving our presentation on coronary heart disease. I'm Chloe.
I'm Anna.
Casey.
Olivia and Tess.
CHD happens when your coronary arteries get narrower and reduce the blood flow to the heart. CHD starts with injury or damage to the inner layer of the artery. This damage causes fatty plaque deposits to build up on the site of the injury. These deposits consist of cholesterol and other waste products. The accumulation is called atherosclerosis. If pieces break off, platelets will clump the area, attempting to repair the blood vessel. This clump can block the artery, reducing or blocking blood flow and leading to heart attack. Risks of CHD. So some modifiable risk factors include smoking, hypertension, lack of exercise, poor diet, high blood cholesterol, diabetes, obesity, dyslipidemia and atherosclerosis promoting diet. Dyslipidemia refers to abnormal concentrations of serum lipoproteins. An increased serum concentration of low-density lipoprotein is a strong indicator of coronary risk. Hypertension is responsible for increased risk of atherosclerosis. Non-modifiable risk factors include age, gender, and family history. Some signs and symptoms of CHD include angina, which is chest pain, which will usually occur in the middle or the left side of the chest, and shortness of breath, which is known as dyspnea. Or you could even have a heart attack. Some signs and symptoms of a heart attack include angina, coughing, dizziness, nausea and vomiting, restlessness, and clammy skin.
So I'll be talking about the prevalence of coronary heart disease. So coronary heart disease is a leading cause of death, and there are significant variations in heart disease death rates across Australia. Some regions have death rates that are at least double the national average. This occurs mostly in regional and rural areas and among the Indigenous population. This highlights the poorer heart health that many people experience in these regions. Cardiovascular death rates, including coronary heart disease, remains a major cause of death and disability across the globe. In Australia, cardiovascular disease was responsible for 8.6 million deaths worldwide in 2015. Coronary heart disease is also the most common disease in Australia. 18.3% of the Australian population have reported having a disease of the circulatory system from 2014 to 2015. As you can see, coronary heart disease is a highly prevalent disease in today's population and contributes to a large burden on the healthcare system. Prevalence in the hospital system. Cardiovascular disease was the leading cause for hospitalisation from 2014 to 2015 in Australia and remains today as one of the leading causes for hospitalisation. This places a large burden on the healthcare system. Hospitalisations for heart conditions such as coronary heart disease have risen steadily in men and women over the last 10 years, and more than 540,000 major procedures for cardiovascular disease was performed from 2014 to 2015. This means that there is a large burden on the Australian community. So how do Australians understand the prevalence of heart disease? Statistics reveal that overall, the Australian population does have a poor understanding of cardiovascular diseases and the prevalence of such diseases. Australians are more likely to see lifestyle causes such as poor diet, lack of exercise, as a risk for coronary heart disease, rather than factors such as high cholesterol and high blood pressure. Although blood pressure is the largest attributable factor for heart disease, in 2017 more Australians nominated stress and alcohol consumption as a key risk factor in place of high blood pressure.
Today I'm going to be talking about the MDT. So firstly, touching on the ways in which CHD is diagnosed. There are many tests such as electrocardiograms, nuclear medicine exercise stress tests, coronary angiograms, chest x-rays, and a combination of blood tests. In regards to the treatment, medications used are both in acute and chronic cases. We have ACE inhibitors, beta blockers, diuretics, inotropes, and digoxin. In terms of the professionals that make up the MDT team, we have the primary doctor being your GP, who is there for your routine preventative healthcare and your main contact for advice. The cardiologist who diagnoses and treats heart problems, other doctors such as surgeons and specialists, clinical nurses, nurse practitioners and physician assistants may perform tests, provide education and counselling, Physical and occupational therapists assist with cardiac rehabilitation. Mental health professionals help patients and families deal with emotional stress. Dietitians provide healthy guidelines. Social workers help with financial, legal and other issues, and pharmacists are the resources for medication information. And most importantly, the patient is an essential part of the healthcare team because they're responsible for their follow-up of healthcare instructions, communicating with the MDT to improve their quality of life. Some of the important principles of the MD team are implementing of evidence-based guidelines and including systems for optimised pharmacological and non-pharmacological therapy, the observations of signs and symptoms which allow early detection and deterioration, and including the patient, their families and their carers in their aim of care. So the best way for patients to avoid CHD is to reduce their amount of modifiable risk factors, and it's the multidisciplinary team's job to educate patients on lifestyle changes such as smoking, as nicotine can constrict the blood vessels and forces your heart to work harder. The control of blood pressure with regular GP checkups, the control of cholesterol, diabetes, exercise, cardiac rehabilitation, a healthy diet, and maintaining a healthy weight and managing stress.
So the multidisciplinary team, also known as Allied Health, are a collective group of medical professionals that work together to diagnose and treat conditions and to provide the best possible outcome. A team focusing on those diagnosed with coronary heart disease may be dietitian, an exercise physiologist, or even a social worker. This multidisciplinary team care begins in hospital and is continuous after discharge. This is called discharge planning. The Heart Foundation states that there is evidence that clearly identifies that the MDT specialised coronary heart disease care improves the outcome. In addition, according to the European Heart Journal, effective discharge planning improves outcomes, alleviates suffering, and creates a better experience for the patient and their family. Patients who are diagnosed with coronary heart disease should commence MDT care within 24 hours to a week upon their discharge. The role of the MDT requires ongoing meetings regarding each patient's case, ongoing discharge planning while the patient is admitted, to continue or implement community-based services, and also a GP referral. An important thing is also to explain to the patient any new medication that they may be on, and especially educating the patient on their new diagnosis. On the next slide, this is a list of what MDT team do. So they will have to firstly assess the functional capacity and determine the patient's strengths and weaknesses. This will determine the best care and compliance to a new lifestyle for the patient. Some responsibilities of the MD team include to ensure that patient's medication plan is up to date and correct, to manage any comorbidities and other related conditions, to assess diabetic patients regularly, provide preventative care such as vaccines, and to assess lifestyle risks such as smoking, overweight, alcohol intake and diet, also assessing the patient's ability to self-care and knowing the patient's health literacy status. For example, a patient is diagnosed with acute coronary heart disease. Effective discharge planning will ensure that the patient sees their GP within the week, is seen by the cardiologist specialist within 2 weeks, and followed up by a multidisciplinary service, such as a community care nurse, a pharmacist, and even more allied health. This involves considering the prognosis, possible altering lifestyle choices, and implementing a standard of exercise. Overall, to improve quality of life, it is the most important goal, and involving a team of qualified individuals who all strive towards this. They improve the quality and health of those diagnosed with coronary heart disease.
So today I'm going to be talking about the Australian government policies and strategies on coronary heart disease. So one of the main preventative risk factors surrounding the cause of coronary heart disease is tobacco smoking. There are 3 main groups of the Australian population that this strategy can be aimed at. These are known diagnosed coronary heart disease patients, high-risk individuals, and the general population. The Australian National Tobacco Strategy works towards reducing the prevalence of smoking among those at risk of coronary heart disease, and it is considered one of the most important strategies of prevention. They provide a clear and concise understanding of tobacco control and its implementation. The goal of this strategy is to improve the health of all Australians by reducing the prevalence of smoking and its associated health, social and economic costs and the inequality that it causes. So, the National Heart Foundation of Australia has a program set up called Jump Rope for Heart, which strongly promotes fitness and health to school-aged children through skipping. The main goal of the program is to educate children and raise funds surrounding cardiovascular health. Through the program, over $200 million has been able to put towards research, cause, diagnosis, treatment and prevention of cardiovascular disease in Australia. Due to physical inactivity in childhood, it can be one of the leading causes to cardiovascular disease, such as coronary heart disease in adulthood. Not only are these children raising funds, they are gaining a positive attitude towards maintaining a healthy heart through exercise and healthy eating. By starting the mentality young about the importance of heart health, it will allow future generations to have a grounded understanding about their health. So, finally, the Medicare benefit schedule allows a patient to an amount of healthcare services that are subsidised by the Australian Government and managed by the Department of Health and Ageing. Medicare deal with the planning and management of coronary heart disease as it is considered a chronic and terminal condition. If considered eligible due to being diagnosed with coronary heart disease, the patient can be referred by their GP for up to 5 Medicare subsidised allied health services in the management and treatment of their condition. This initiative allows Australians at age 45 to 49 years, over 45 years, and Aboriginal and Torres Strait Islander people to have a health assessment who are at risk of coronary heart disease, with the aim of early detection and intervention.
So in conclusion, thank you all for listening, and we just want to stress the importance as nurses in today's society that we all understand cardiovascular disease and how this disease is such a massive burden on our population, and it's important that we all understand this and can work with our patients to make them feel better. Thank you.